Good morning, everyone. Thank you for inviting me to present this contribution on ocean health and human health, the links and the research agenda. As you know, or probably you know, that the ocean provides us many ecosystem services, resulting in societal benefits, for example, food or leisure or energy. It is demonstrated that a healthy ocean provides us more ecosystem services and benefits than a degraded ocean. There is increasing evidence of the complex links between a healthy ocean and human health, both in physical and mental terms, either positive or negative. In this complex figure, you can see that there are different human activities, renewable energy, shipping, scientific research or discovery, coastal communities, etc., which are linked by positive impacts in these blue arrows or negative ones, these yellow arrows. And there are benefits for humans in blue and also harm for humans in yellow. Among the ecosystem services provided by the ocean, the non-material benefits obtained from cultural ecosystem services are of paramount societal importance for their contribution to human health and well-being. There is a complex number of indicators from the essential ocean variables, the essential climate variables, and the essential biodiversity variables, which are connected with the essential ecosystem services variables. And finally, all of them are related with the good quality of life. The cultural ecosystem services include the use we do from ocean in terms of recreation and tourism, maybe active or immersive, but also simply aesthetic experiences, which are passive or observational. An example of the ecosystem services cascade could be the whale watching activity, which is observational, and the links with human well-being. We have the environment with the different ecosystem services supporting intermediate ecosystem services, the final services, and then the social and economic system in which we have the goods and benefits from those ecosystem services. Following with this example, the biophysical structure are the qualities of species and ecosystems. The functions that are those that are viewed or observed or enjoyed by people. The final services are the whales, birds, seals, or reptiles that can be enjoyed by wildlife watchers. The benefits could be recreation, fitness, distressing or mental health, ecotourism, etc. And the value are the willingness to pay for whale watching, savings in mental health, etc. Some examples of links could be this, the human health and the distance to the coast. This is a very nice study which was undertook in England with 48 million people, the self-reported health and the controlling for area, income, education, and employment and crime. And you can see here that the closer to the coast, less than 1 kilometer, or between 1 and 6 kilometers, the reported health is higher than far away from the coast. And it is interesting to note that the effects are strongest in poorer communities. And also the people get happier and healthier when they move to the coast and vice versa. And this is very important because finally, if you live close to the coast, your health could be better. And why this? Probably this is because close to the coast there is less stress, there are more exercise, there are more social exchanges or social contacts, and there is close or connectedness to the environment. And this results in better health for humans and well-being. This is another example of the links. And this is a study also in England in which they studied the recreational visits to protected areas and non-protected areas, both in inland and coastal zones, and the outcomes was the mental health and connectedness to nature. And you can see that in three different areas, the urban green, rural green, and coastal areas, there are significant differences between protected in green and non-protected areas in white. And this is especially true in the urban green and the coastal areas. Another nice example is this on the reducing pain in medical settings. This was undertook with 70 dental patients with minor treatments, and they were exposed to standard care. They were shown virtual cities and virtual pitch. And then the outcomes was the pain immediately after the treatment or 7 days recall. And you can see here that the standard care show more pain than the city virtual city or virtual beach, and the difference are significant. So the virtual beach views are much better to reduce the pain. And this is interesting because it is also 7 days later, it's still again those differences. So beaches or views from the sea can reduce the pain in this kind of patients. Another interesting example is this we did for the contact with blue-green and green spaces during the COVID pandemic lockdown. It was with more than 5,000 participants from 9 countries, and we studied 3 levels of lockdown severity, from very strict lockdown. Then a level 2 is a certain type of outdoor exercise, and level 3 is only limitations. The limitations are only recommendations. And we studied also the access to outdoor spaces, the direct contact with nature, or window views in direct contact with nature. And the outcome was the mental health, depression, and anxiety. And we discovered that the more strict lockdown case was the greater sense of overall poor mental health. In the other 2 cases, there is no clear differences between both in sense of poor mental, but there are differences with the level 1. Then, in these cases, we studied also the nature views from home, no or yes, or the access to outdoor spaces, no, yes. And there is lower odds for depression and anxiety if you are in a strict lockdown, but you have access to nature views or to outdoor spaces. And in the case of young people and women, there are higher odds for depression and anxiety. Then we studied only the strict lockdown with 3,400 responses, and we studied the views from home, few or urban views, mixed views or natural views, and the access to outdoor spaces, non-balcony, garden or patio, and shared or public areas. And there is a gradient. A few or urban views are associated with higher odds for symptoms of depression and overall poor mental health. And in the case of the access to other spaces, again, there is a gradient with no accessible outdoor spaces associated with higher odds for symptoms of depression and overall poor mental health. Another example is the environmental, social, and economic impacts and benefits of surfing. We did a literature review with a bibliometric analysis and systematic review, and we studied the three dimensions: social, environmental, and economic, and the effects, impacts, negative, and benefits, positive, and some examples. And you can see that in the case of social benefits, the physical and psychological benefits for surfers and the sociocultural benefits for local community are higher. So then there is also benefits for environmental and economic, and these benefits or impacts go beyond the direct users or surfers, for example, for local communities. All implications and stakeholders should be considered to guarantee the sustainable management of the activity, for example, a cultural ecosystem service benefit. But then we proposed an agenda on ocean health and human health. But what we need to know in terms of research and management? We need to collect evidences. We need to analyze the marine planning models. We need to collect information on impacts on ecosystem services and values. We need to collect information on well-being benefits and risks of coastal living. We need to take information on Earth observation approaches, ecosystem services trade-offs, and also decision-making, stakeholders, etc., and scenarios. For doing that, the Decade of the Ocean from UNESCO is quite important. We are participating in one of the proposals, which is Coast Predict, and we think that there's a good way to collect this kind of information to then put in place the agenda we propose. These are just some examples of that agenda, divided into topics: climate change, use of ecosystem services, pollution, and ecosystem conservation, and some trends. For example, for climate change, there are expected more extreme events. And the research gaps in human health, we identify these threats to life in coastal areas. Sea level rise and migration, we consider that could be more physical and mental impacts. For ocean acidification, the effects are not known, still not known, but probably related with nutrition. In the case of increasing temperature, probably there will be increasing infectious diseases and parasites. For species shifts and invasive species interactions with biodiversity and well-being. In the case of ecosystem services, healthy and sustainable seafood, provision of omega-3 and cardiovascular risk. In the case of recreation, excessive tourism threatening the benefits, etc. We have a long list of different research gaps that should be studied, should be investigated in coming years. So as conclusions, there is increasing global evidence supporting links between ocean health and human health. Our health depends on many provisioning, regulating, and cultural ecosystem services and their good status. If we are able to transmit this idea to the society and policymakers, probably we can improve the sustainable use of their resources. Probably one of the ways to undertake this is by monetizing the benefits that we obtain from the ecosystem services. Where you live is important, but less important than how you use the coast for recreation and other uses. Global research into public perceptions and preferences on ocean and human health are needed. And we have a research agenda that needs to be filled in. Thank you very much for your attention, and I'm open to questions.